Hi, I'm Maya. I'm a fourth year medical student and I'm currently on the Subfertility and Assisted Reproductive Surgery SSM. I've decided to do my presentation looking at IVF and more specifically looking at the regulations and the eligibility criteria which are used in Derbyshire and across the country to determine who can access the NHS funding and who cannot. I think that IVF is a topic that's talked about quite a lot. People have heard of it, but the regulations and the funding that's available is a bit more complicated and can have a huge impact on patient lives and how they access this care. So it's really important to discuss it. Just starting with basics, funding is allocated across the country by integrated care boards who make decisions about how much money should be allocated to services such as IVF and who should be able to access this funding. And the idea of this system is that these integrated care boards in specific areas such as Derbyshire can consider the needs of their local population more than a national policy. And they need to make sure that their services are in line with NICE guidelines. And the idea is that this care is personalised to the area, but it does mean that funding decisions vary across the country. You can see on the map how many different ICBs there are, and a lot of them have made different decisions about the kind of funding that's available. Looking more specifically in Derbyshire, the guidelines state that infertility can be investigated after failure to conceive within 12 months of regular unprotected intercourse. You can be referred to fertility treatment if you've had 2 years of regular unprotected intercourse, and that's if there's no known cause of fertility, or if patients have undergone 6 rounds of artificial insemination for female same-sex couples. So there's a difference between when infertility can be investigated and when infertility can be treated, such as IVF. And that's an important distinction. The ICB in Derbyshire will fund IVF for these groups of people, as long as they fulfill the eligibility criteria that I'm going to go through in the next slide. So in Derbyshire, patients can be eligible for one full round of IVF if these criteria are met. So the first one is that both patients are aged 40 or below. Patients aged 40 to 42 can be offered one cycle, but only if there's no evidence of a low ovarian reserve, so that's how many eggs are left, and that there's been a conversation about consequences of IVF and pregnancy at this age. FSH levels is another criteria, so these must be below 8.9 in the female patient. And I'm going to go through some of the reasoning behind some of these guidelines in the next slide. BMI is another one. They must be 19 to 30. And again, I'm going to go through the reason for that in the next slide. Both parents must be non-smokers for 28 days before treatment and continue to be non-smokers during treatment. And treatment can be taken away if they are found to be smoking. E-cigarettes do not count for this. In Derbyshire, neither parent or patient can have biological or adopted children from this relationship or from a previous relationship. And they must have gone through no more than 2 previous self-funded IVF cycles in order to access the NHS funding. Just looking at the reasoning behind a few of these eligibility criteria, FSH levels are used as a prediction of ovarian response to gonadotrophin stimulation. And the stimulation is used in IVF to maximize the number of eggs that can be taken from the female. So this just predicts how many eggs can be taken, and this contributes to the success of IVF. A BMI of 30 or over in either partners, for female or male, is associated with reduced fertility. One example of this is that it's been shown to decrease oocyte collection rates and increase early pregnancy loss rates. But it's important to note that this reduced chance of conceiving can be reversed with weight loss. So if a patient comes in with a BMI of 36, for example, as long as they lose enough weight to reduce their BMI to 30 or below, they will be able to access these services. Smoking is another important factor, and this can affect a range of factors contributing to IVF success rates. So IVF fertilization and embryo implantation rates using sperm from males who smoke are reduced. Smoking has been shown to bring forward menopause by about 2 years in some patients due to women who smoke having lower ovarian reserves. A lot of hormones involved in pregnancy and IVF, such as testosterone, FSH, estrogen, and progesterone levels, are all affected by smoking. And smoking may slow the growth of the developing embryo and affect the number of cells which die during growth. So clearly, it has a large impact on fertility, and both patients must not smoke to maximize the chances of success. I don't think it's possible to talk about IVF without mentioning the postcode lottery. This is something that's talked about a lot in the media. It's something that a lot of people can be very frustrated and upset by, mostly because it can seem quite unfair. So this basically refers to the fact that patients around the country can access different levels of care. And I'm going to go through some examples in the next slide. But it means that people who live miles from each other may be able to access different number of IVF cycles or may be ineligible for NHS funding. And it's one of the rare areas of the NHS care where access is not equal. Um, and if people are turned away from NHS funded IVF, that's something they'll have to consider paying for themselves, which can be quite expensive. Obviously, this is an emotional issue for many families. It's really disappointment if treatment isn't successful. That is quite a mental weight to bear, hoping for success and sometimes it not being successful. And couples can feel a lot of pressure to have successful treatment due to the risk associated with a higher age of the patients. So it's something that there's a lot of pressure to get success early on. And the fact that care varies across the UK doesn't help the situation. So just looking more specifically at some examples of different ICBs and what they've decided to fund. So you can see that the number of NHS cycles funded by the NHS varies. In Derbyshire, it's one. In other places, it could be two or even three. And so this is quite unequal. The age that they'll offer them to changes as well. So some people may be ineligible in parts of the country, whereas if they live somewhere else, they would be able to access it. The number of children that patients are allowed to have, how many cycles of IVF they've tried before, and also the cryopreservation offered to them. So this refers to the freezing of eggs, embryos, or sperm for storage, and whether this is funded or not, and for how many years this is funded varies across the country. So you can imagine how frustrating this must be for some patients when they're turned away from care that other people may be able to access. Just talking through a few more private funding options which exist. One example of this is pre-implantation genetic diagnosis. So this is a service which can be offered for couples with risk of serious genetic conditions, such as cystic fibrosis, sickle cell, and Huntington's disease. And this just involves testing embryos for specific genes that they're at a high risk of inheriting before the embryos are implanted, which will ensure that the genes are either not expressed or not carried on. And in Derbyshire, parents who meet the criteria can receive 3 NHS-funded cycles. Surrogacy is another option that some couples have to consider if the female is unable to be pregnant. This is never funded by the NHS, no matter where in the country. Intrauterine insemination is a procedure where sperm are put directly into the womb while the female is ovulating. And this can be available to some people who fulfill the criteria. Similarly to IVF, this varies between ICBs. Gamete or embryo cryopreservation, as I mentioned before, is a procedure involving the freezing of eggs, sperm, or embryo. This can be offered to patients undergoing treatment which is likely to affect their fertility. So one example of this will be chemotherapy. And when the eligibility criteria are met, storage is funded in Derbyshire for up to 3 years. As you saw in the previous slide, other ICBs offer different services. And I just wanted to highlight how much IVF can cost. So it's up to £5,000 or more for one cycle. So patients who are ineligible for NHS funding are shouldering a massive cost for trying to access fertility treatment. And that's important to be aware of, as you can imagine the stress that this puts on couples. And I just wanted to briefly mention some future treatments which are being investigated or developed. So one example would be bioprosthetic ovaries, which may be used to restore ovarian function in women who had their ovaries removed or damaged. Using stem cells is also being looked at, and this could help overcome challenges such as euplasmic aging to produce healthy sperm and eggs in older patients. And metabolic profiling is also being looked at, and this is where the embryo's energy levels and development rate are investigated, and this is used to identify which embryos have the highest chance of a successful implantation. And this could hopefully be used to boost the success rates of IVF, and reduce the number of cycles that patients have to go through for a successful pregnancy. So thank you very much for listening. I've just got some references in the next slide, but thank you very much.